I am Dr. William Sunstein of NSPC Brain and Spine Surgery, and welcome to our 5th podcast of the Spine Bros.
Yeah, I'm Rich Obedian of Island Spine and Sports.
My name is Ana.
My name is Marcia Polino.
Thank you very much for coming, ladies.
Yeah,
we're very
fortunate to have you both here today on a especially cold morning in Long Island.
It is.
But we're happy to see you, and we wanted to talk to you. You know, we wanted to talk to a patient and also a family member as to what to expect and how you came to see us. Number one, what happened with you, and to give a patient's perspective on big spinal surgery, which is what you underwent. So
for all you who are tuning in, Marcia is a patient of ours who we ended up operating on, and we are so appreciative that Marcia and her sister Hannah came in all the way from the Bronx, which is quite a distance, and to talk to us and our listeners about their experience, basically from start to finish, where they actually come to meet both of us and discuss their problem. And we learned that we needed to do something about it. And it came to pass where Marcia had surgery and now is here to talk about her experience.
So let's start with how you first. I think the first thing that happened was that on your phone,
how did you tell?
You got a message about Dr. Sonstein.
How did you come to pass?
It was almost spiritual in a way.
Yes.
Yeah.
But, why don't you tell us this? Why don't you tell us the story in your own words of what?
How did you meet us?
What happened?
Well, I was in Shabbat that day, and I have a lot of pain that day, a lot of pain.
A lot of pain in your back and in your legs.
Yes, and I prayed to Hashem to give me the way that find somebody to help me, because I was miserable.
How long were you having problems before?
1 year.
1 year.
Yes.
And what were your symptoms?
It's a lot of pain in my leg, numbness. How you call it?
Weakness.
Weakness.
Which leg? Was one leg bother you more than the other leg?
The left side.
Left side.
The left side. And my back, my neck. Everything. Yes.
And you had been seeing treatment before you came to see us.
Yes, but just physical therapy and painkiller, and that's it.
What kind of physical therapy? How long was it? Undergo physical therapy?
Like 6 months.
6 months of physical therapy.
Yeah.
And what type of pain medications were you taking?
Just how is the name of
The most of the pill, the
not
things
heavy.
Not the heavy.
No narcotics.
Yeah.
Nothing narcotics.
No Percocets, but more anti-inflammatories like Tylenol or
Tylenol, that was the one.
Yeah,
or,
they gave me
or
Tylenol.
Advil, Motrin.
Gabapentin.
Yeah, no,
No gabapentin.
that one was after
The surgery.
But before it was steroid, I think.
Steroids, yeah. Just some steroids.
Steroids.
And put you on steroids. Did your medical doctor do that, or?
Yeah, I went to the medicine room first
Okay.
because the pain was terrible.
And you had been diagnosed with a herniated disc in your lower back?
Yes. They sent me back home that day, but the next day, she take me again into the hospital because they said because the doctor, he came to me and he said that I, because you age, and I said, it's not my age, because it's the pain that I have is not, if I had to live like that in my.
It's a rude question to ask, especially a woman, your age.
Yeah.
But how old are you?
61.
61. But you look like
Almost
you're 41.
62.
You look
Thank
very,
you.
very young.
Yeah.
And 60, I think, is the new 40, because there are a lot of people who in their 60s who are very active, very independent, who are, who can be disabled. And believe me, 61, we've operated on patients even into their 90s with the same problem that you have.
That is the point.
And it's something that Bill and I have seen a lot of is age discrimination. doctors who say, "Oh, well, you know, you're it's a certain age. You should just expect to be in pain," and that's, in my opinion, that's ridiculous.
Yeah, but I don't get that in my mind, because I say no.
In our minds,
He's
we're all
wrong.
21.
It's wrong
It is.
because sometimes you have 62, 70, whatever, but you don't feel like that.
Yeah.
Because I'm a strong woman, I do everything like normal every day.
Yeah, you're a member of society. You're doing.
Yeah, and
You live by yourself. You live with your sister. You're doing your own shopping. You're doing your own cleaning. You're active.
yes,
Very
a
active.
little shocking when you went to that day we went to the ER and the doctor, the first thing he says is like she has a little pain when she can even walk, and one of the things he said, no, because your age and you have some arthritis and the pain. I said, no, she don't have no arthritis because she can even walk.
What hospital did you go to?
Montefiore.
You went to Montefiore.
Montefiore in the Bronx, yeah.
Interesting.
Yeah.
But twice.
That's where you trained, isn't it?
I did my
Yeah,
training, my neurosurgery residency at Montefiore. Yes, I did.
Yeah.
So maybe that's how they got you, because your legend lives on in the Bronx.
I must have made some mark
You must have
there.
left some impact.
I after being there for 6 years, yes.
Yes.
Amazing.
But the thing is, the second day, the doctor, he said to me, "Oh, I want to give you more
Painkillers.
painkiller."
So they admitted you to the hospital.
More stronger. And
I was intervening in the moment to get more information about what she has. I'm not going into a medicine field, but like I try to be more thought when I have to do something. It's like I had to see what's going on. So I asked them to give me a right answer, not only what you see is how the images says. So they don't want to do even an MRI or nothing. They don't want to do images or nothing.
They didn't do MRIs at the
In the
hospital?
moment, no.
At the,
At the moment,
Initially,
no.
they didn't do it.
So because she go to the ER, so that process is go when it get inside to the hospital.
Right.
They
were
want
you
needed
admitted
to
to
the
the
hospital.
hospital when you
So
went there?
after that, I
the
Admitted
second
you
time,
overnight.
yeah.
You were there.
she was overnight. Yeah.
Okay.
So I they want to give her discharge, and I intervened and said, no, listen, she don't go anywhere until you give me a right answer. Otherwise, she don't go anywhere. That's the way that we find out what she has. One of the things was she has to stay in the ER, kneel because
Right.
she can't even stand.
Can't walk.
She can't even walk. And that's it. That's the process. That's the first process that we went.
So, that's really important. You were a strong advocate for her.
For now, yeah.
And that's really
definitely.
important,
It's
you
a
know,
family member.
for-
You have to be. I believe in any kind of, not only this kind of disease or whatever. I think the family member had to be involved. First of all, because you make a relationship to the doctor, like right now we are here,
Sure.
and it's another face that you see, and then if something happens, it's better to discuss. And sometimes like the person is in that specific moment that in pain, don't understand a lot of things because they are in pain.
Right.
So the family members are the people that carry that all the information and try to the person get better and better and better with the doctors. It's like a team. I
Not
believe.
everybody has
I
an
believe
advocate
that
like
is
that. That's
the
very nice.
right
to
medicine.
have.
No, but it's really important, because sometimes when you're in a lot of pain,
You can't think
They can-
clearly.
exactly.
you're not
You can't
thinking
think that's why
clearly,
they-
and you're not really understanding what's happening.
Exactly.
You're just focusing on your pain. You might be on
Exactly.
painkillers. You're not understanding what's
Exactly.
happening.
How-
and it can be a
We
very
are
scary.
more focused in how we're going to fix her.
Yes.
How long were you in the hospital for?
6 days.
6 days.
6 days. And during the time they did do an MRI, obviously.
Yes.
Yeah, that's the only.
And that's where they discovered the
Yeah.
problem you have.
And your MRI showed a very large herniated disc at the L4, L5 level that was causing severe stenosis.
Yes.
So I hope they changed their tune as far as it's because of your age, because not everybody who's in their 50s and 60s gets a massive herniated disc.
You had a
Things happen,
very
you
legitimate
know.
reason for having the problem.
It's that things happens too. Accident happens, or any other reasons happens in our health, and our bodies react to different kind of things. It's like when you have the flu. It's a cause. Sometimes it's not because you age or because you're not a kid. You hold better the disease in your body. No, it's like something happens in your body, and everybody's different. So some people, they can do like exercising, they break their back, just lay down,
Yep.
and it's different.
A lot of people develop these problems just by doing normal
Exactly,
activities.
normal activities,
Not
yes, and
necessarily do
there's
they
nothing
have
about
to
the
have a
age.
big fall or a big trauma to
Yeah.
get these things. They just happen with the normal degeneration.
Right. There's
of the
normal wear and
spine.
tear.
Exactly.
We'll get older.
Yeah.
but to get such a large herniated disc is beyond. And you know, I'm very glad that you were able to find Dr. Sonstein initially, and then
Yeah.
Well,
and
what
then get
happened
care
at the
you need.
hospital? You basically were there. How did they treat you? Or how did they make you feel better at the
Oh,
hospital?
nothing.
and the
nothing.
fir- and the
first-
Nothing worse.
Just
nothing.
medication.
We're talking about the
Yes.
first time.
Yeah.
They gave you medication, but you were able to
medication.
leave the hospital. Did you feel like you had some improvement from being there in the hospital for that time?
But they gave me a lot of painkillers,
Painkillers.
even in my IV and oral.
Orally.
Did they recommend an injection or anything like that, like an epidural at the time of being in the hospital?
No.
Not in the hospital.
And they didn't recommend surgery either.
And then the lady, I have a lady next to me, and she said to me, "Why you don't take what's the pills? The the one that that is a strong one.
OxyContin.
Oxycontin. Yeah.
Yeah.
I say Oxycontin. I don't know what it is. She say that happened to me once, and that helped me.
But that was a different story. That's why we say this is something different what she has, because the way that I never saw her like that. She was a strong woman. She a very active woman. And one day, as a family member, to see one person can even walk and always in the moon that you can even talk, because the pain is so unbearable that she can even do nothing like
Right.
they did before. And thankfully, if you move on as a family member, but she don't move on,
Right.
it's like you stuck.
It starts to affect every
It's
aspect of your life.
everything, yes, of course. It affects
It like
the
leads
family.
to a
Yeah.
downward spiral. You become depressed.
I'm going to say she's the spine of the family.
She's the spine of the family.
So what happened after the hospital stay? What did you do at that?
Well, they gave me that pills that night. The next day, I said, "Bro, I don't know what happened because I can walk, with pain, but not like before, the day before, because I was, and they discharged me the next day, I think.
But they give you a
6 days.
cocktail of medications too.
But it helped.
gave
It
me-
helped somewhat enough for you to be able to walk.
They gave yes,
Yes,
That-
that's the main
with that,
thing.
with
yeah.
that medicine, that
The medicine helped.
Yeah.
Okay.
That's the only
But when I went home and then I said, no, it's not one pill. They gave me a Prelasoc, I think. Prelasoc? Prelosec, I think, something like that. And that made me, I don't know.
She disappeared completely. It's like, it depends on the medication, because they give you a cocktail of medications
Yes.
to try. When they give you a cocktail of medications, you don't know which one is make the feel better.
Yeah, that's a
So
problem.
it's something that, which one is?
But one was a
What-
painkiller.
Probably a painkiller,
All
muscle
of their
relaxer, and
painkillers, they started like
anti-inflammatory.
Yes.
no.
That's usually the cocktail.
The pain was so bad, and she started taking medications in the hospital for every 2 hours or so.
Did they give her steroids too in the
I
hospital?
did the steroids, yes.
They gave you
definitely.
steroids. Okay,
Yeah,
that
yeah,
can
yeah.
oftentimes reduce the
Yeah,
inflammation.
reduce inflammation,
It's an
yes, yeah.
anti-inflammatory steroid.
Yeah, yeah.
Yes.
It's a strong anti-inflammatory. It's not something you want to be on a long time for, but at least in a temporary sense, it actually can reduce a lot of the inflammatory component to your pain.
Right. And the problem with pain medication is that when you're on those narcotics and those muscle relaxers for a long period
Yeah,
of
yeah.
time, it affects your ability to think. It affects your
That's
ability
what
to
happened to her.
function.
Yes.
Yeah.
You become very confused. You're like almost out of it.
I say
Lethargic, sleepy. You can't function the way
Exactly.
you
You
used to. You
get
can't think straight.
constipated.
in one point,
Which I hate.
and
Yeah,
during
these
the
are all
night,
problems of narcotics.
Yeah,
and
and
it's
during
very addictive as well.
yeah, and during the night, at one point, I asked her, because I was that's what I'm saying, when the family involved with the doctors and the doctors involved with the family, it's something very important. Because in my case, what I did was I like to be in charge every single medication and every single time, milligrams and everything. I encourage every family member, they see this podcast, like, to be with the family member. It's very important because it's a team. Doctors are busy. Doctors, just receive the information for the nurses when they're not physical in the moment, because they're doing other things like surgeries, important things like surgeries. But the information came from one hand to another hand. It's like the patient, nurses, doctors, right? So, and in that case, what I did myself is like be in charge of every single medication. They give it to her. I have it in my phone and look at how many milligrams she can take it, and the body and the time and everything. That's my job in the moment that she was in. I don't know they have the kind of, not everybody has that kind of time to do that kind of stuff. But in my case, what I did is in one point in the night, right, I said no more medication to see what's going on, because medication until I see the results of the medication, what happened with the patient. And in this case, my sister. So what I did is like, okay, you agree? I asked her, you agree to don't take no more medication to see what's going on in your body, because they give you medication because the pain was so bad that she can't even sleep. And she told me yes. So okay, and she told me whatever decision you take is fine. That's the agreement that we have as a family member and patient, and thankfully, we agree with the doctors, and it is amazing thing when you work as a team, as a family member, a team with the patient, and then the doctor. Physically, sometimes you don't see the doctor inside to the ERs because you are busy. You are doctors. You are in your field, and you have to work on it. And a lot of patients that has the same or better or worse.
Right.
So in my case, was what I did. Not everybody is the same, but I encourage everybody to get involved with the team, because when you're inside the hospital, it's a team.
Yes. In my experience, the painkillers, what they actually do is they don't really get rid of the pain. The pain, you're aware the pain is still there.
It takes the
but
edge off.
It almost feels like you don't care anymore.
Exactly.
Like one time I was, this is early in my career, I was reducing an elbow dislocation in the emergency room. And I was using weights, and I successfully reduced the elbow. And as the weights came off, it landed on my toe. I broke my toe.
That wasn't supposed to happen.
No. It's one of the risks of being a surgeon, being an orthopedic surgeon. So it was hurt so bad, I could barely walk. And I went home that night, and my wife had some Vicodin, which is a narcotic painkiller, in the medicine cabinet, and I took one because I was I couldn't sleep. And what I noticed was that the pain was still there, but I didn't care anymore.
Exactly.
My mood was okay. I was like, okay, well, it's there, but it doesn't really bother me as much.
Exactly.
But it's not a feeling you want all the time. I didn't really like that feeling at all.
It's a short-lived feeling.
And so you want to get to the cause of what the problem is and actually fix that.
Exactly.
So eventually, so once you got off these medications, you got a message on your phone about spine problems. So tell us what that message was, because it's kind of
what actually happened.
It was like an answer to your prayers almost.
To me initially.
Oh yeah, and then that happened that night. I was in my bed, just miserable. I don't know how, because it's something that I can explain to you right now. Your picture, your face, and I said, but I don't know. And I call my my son, and I say, but I don't know why that is a doctor, and he's I think Elohim.
Right.
So I came.
Something with me.
So was it like an advertisement for?
No,
I don't
was
looking for that.
something strange, because she was looking for put some music, Shabbat music, and the computer, and then appear your face
So
right there.
my face appeared during Shabbat music.
Yes.
Yeah,
Yes.
right there, right there.
You had just,
It's a meeting.
you had just returned from Israel in August of that year, so maybe it was like something mystical.
I don't know. That's very.
It's something
And then I started my song. He's not technology ones. That and
It's a
he
savvy.
looking
It's a technology for savvy.
for your
Background.
background, and he said, "Mom, I think Elohim."
This is a calling.
This is the doctor.
from
I don't
Hashem
know, but I don't know.
to
but you
seek out
believe-
this doctor now.
Yeah, and I said,
No, you call me.
"Sure." And I
And you call me
her.
right away. I have the doctor. They're gonna take care of me.
Were you Googling spine problems or things like
Be
that
honest,
on
I
your
don't
phone?
do nothing. I trust when it's
My son, he's
Yeah.
he's the one. He say that yes, he's.
So he
and
Googled Dr.
then-
Stonsky and said, yes, go see
we do
this
the
man.
research. We do the part of the faith.
Got it.
And
Okay.
actually, and actually, when I see the face, people, I can see even in the computer. I can say, that is good guy.
He's a good
I don't
guy.
know
I
why.
can affirm that. He's a good guy.
Yeah.
So,
Yeah.
I don't
Fine.
know.
He's got a gentleman.
I don't know why your
feel
face
that way
about
look
it.
like an angel that night.
Well, don't go that far, but that's
For
that's
us was because in reality we're looking for the answer. she started praying for a long time. I'm in the same way. We start praying for somebody to help her. Because major surgeries, because they spoke about surgeries later on. It's a difficult decision to make.
It is.
It's especially in the back. It's
Sure.
the spine is one of the things that you have to really think about. And me, I have a open heart surgery long time ago. I was different. Of course, it's risky, but it's different.
Yeah.
Because I can walk. My legs is okay, my back is okay, my arms is okay, everything is fine. And my problem is inside from here to here and inside, and I can move, right? But the spine, we spoke about it. The spine is something that you have to know in which hands you put your spine. I'm sorry to say that, but it's true. It's very difficult decision for a family member, especially for the person is in pain, to put, the trust in one team.
So,
And-
so
Yeah, and we appreciate that. It's very important to have confidence in your surgeon.
Yeah,
You don't want to second guess what your surgeon is doing. You have to
Yeah.
know that your surgeon. And we always think, Dr. Sanzan, as a team, we always think, what is it we want for ourselves or for our own
Exactly.
family? That's really the ultimate test of
We are really, really happy
And-
the
and-
results, and we are really, really happy how you deal with a whole
So you
situation.
came to see me in the office. You made an
Yes.
appointment.
Yes.
How did you make an appointment?
The website.
I call, I get the number.
Got the number for our,
and I
our
call
office.
and Teresa,
Teresa, my
yeah,
secretary.
she's so nice. Very
She's the
beautiful
best.
lady.
She is the
Yes,
best. She's been with me
take
for
care of me. She say,
over
"Oh,
20 years.
let me make the appointment for you," and I was excited that day because we can.
and then you sent her to me.
nice.
I saw Marcia in the office, and we examined her, and she was actually, her problem really was more pain than anything. Neurologically, she was good.
She had some numbness, a little bit of weakness in the foot.
She had mainly intact, function when I examined her, and what she had when I saw her was that she had a L4-5 at the level of L4-5. She had a large disc herniation, but she also had something I like to call fish mouth configuration to the disc space, meaning that part of the disc space was collapsed and part of it was open, kind of like an open book kind of thing. And that to me represents instability because there's a reason why the disc herniates. There's something wrong with that level. It's not stable. There's something not intact there to cause this disc to come out of its place. And she had severe what we call stenosis or narrowing of that canal where the nerves run. And she also had very thickened ligament, I remember, from the actual film, the MRI that she had. And we decided, at this point, I think after a year worth of discomfort and trying physical therapy and everything else and having to be going to the hospital,
She was a surgical candidate.
I felt that she was a surgical candidate. And the way the Spine Bros, we work as a team, as you guys work as a team. We always have the patient see Dr. Abedian as well for his opinion. And I went and sent.
And I agreed with the plan.
Dr. Abedian.
And we ended up scheduling the surgery.
What did we think that we were going to do?
And the plan was to do a decompression, which means to remove the pressure on the nerve roots. And even though her symptoms were primarily on the left, she had symptoms on the right side as well. So we're planning on doing a wide decompression.
Because it was very, very narrow. And, obviously, even though the ligament was more thick on the right, it's still, you can have, the body just decides to have symptoms more on one side or the other side if
Also,
they're both being compressed.
You don't want to just do half the operation and then come back 6 months later, now you have right-sided leg pain. So while you're there, do it right the first time.
The disc was more central and more off to the right, but she had concentric stenosis or narrowing. And we decided because of the instability, we also felt that she needed a concurrent, because you're a young lady, and you had a lot of time left, you needed also a stabilization procedure as well. So we decided to do a fusion at L4-5 using instrumentation.
Right. And the other thing that went into doing a fusion on you was that by doing a wide decompression, if you remove more than half of the facet joint, you create what we call iatrogenic instability, or instability that happens in the operating room because of something that the doctors did. And so to stabilize that adequately, we decided to do a fusion, but to also use pedicle screws and screws with rods to stabilize the spine. And then we place bone graft in the sides also to get it to heal. And that's really the most important part is the bone graft, but the screws and rods are there to stabilize the spine as you heal. So it is what we call a major operation on the spine because there's a lot of moving components. There's a decompression, there's a discectomy, there's the actual insertion of the screws and rods, and then we had our Dr. Baldenhofer was the plastic surgeon who closed the wound to make sure there wouldn't be any wound problems as well. Yeah. And then you were in a hospital for a few days after that.
What was your experience like in the hospital? Like, tell us a little more about going to the hospital. From a patient's
point of view. No, like, tell us what was it like from the moment you woke up in the recovery room and what happened afterwards?
Yeah, but I want to say something before that. I when I went to see you, the first thing that he said, he's sitting he checking me and he said to me, "You are so young to be like that in pain." And I said,
the opposite of what you were told.
The
other what you were told in the
that is the key because he said, "You're too young to be like that."
To be so debilitated by this.
Exactly.
Which hospital did you have the surgery in? Was it NYU? Winthrop?
Yes.
It was NYU. So you got admitted to the hospital that day. We did the surgery. What was your experience like before you even had the surgery? Was it a smooth getting in there and having everything?
Yes, it was very nice experience.
Everything was arranged okay, and you got there and you had the surgery.
Very professional.
I think one of the things I can point it out is that one of the best experiences that we have as a family members, because I'm being in the ERs, like multiple times too. Like as a human, everybody gets sick, in one point in your life, and amazing. And I want to say amazing, and when it's amazing, is the way the team, even in the nurses, ER is ER. A lot of people get sick, and the doctors go around. We don't account in the moment that you get there to the moment that we get to the surgery or she was admitted. No complaints at all. Very professionals,
Professionals.
Very, the team, the amazing team that you guys have. Yes. Amazing doctors, no complaints.
We really enjoy working at NYU because we usually get the same nurses, the same anesthesiologists. Yeah, exactly. We work as a cohesive unit. Exactly. That really makes a difference. Yeah. You don't want to get a different scrub nurse or a different circulating nurse every single time because it just slows things down and makes things more difficult than they need to be.
The things that I see as a family is, because she was in a lot of pain anyways, is that, like I says, it's different when you doctors work as a team. We talk about teams like 4 times already. We over here with that team. It's doctor, family doctors. And that makes so much different in the life of the patient and in our life too as a family member, that you come down and you know that, okay, it's communication, everything is how planned it is. And you, as a doctor, explain us every single detail of what you're going to do. Of course, when you go inside to the ER, to the OR, things happen. Could be a lot of stuff. But the plan was discussed with the family, with us, and give us that security. They give us that confidence that, okay, she's in good hands. I'm talking about as a family member.
Right.
And on the other side, she has her own experience. In my case, I feel like very confident. And always I says, if she's okay, if she feels confident, I feel confident. I feel confident, she feels confident. Right. And the doctor's confident. So everything works. And the team that you doctors has over there is amazing.
Yes.
We don't have no complaints, how they discuss every single detail, how they go and insist that if we are okay with the plan that you have or not, and they discuss to us first. That makes so much different in a surgery, like just a major surgery. I know what she's going to have was a major surgery. Not because I see the images, it's because the way that she was before and the way that she, an active woman all the time, doing every exercise, working, and doing, in change one day, and see her and suffer for so long, you can tell it's not a small thing. Something you can hide it. For example, in my case, if I had a heart disease, I can hide that very well. But when you're talking about the spine, it's different.
Yeah, Her life had turned upside down.
It's always upside down because you can walk, you can move, you see the person slow down, and then you say, when this is going to stop?
So did it stop after the surgery?
Did you notice immediately when you woke up in the recovery room?
Oh, yes.
Yeah,
What was your like? What was it like for you?
The same
afterward?
day.
Same day.
Yes, the same day.
Yeah,
I'm
that's a
so
great
proud.
thing.
I'm so proud. But
Did
the
you
same
get up
day-
that day?
Yes.
Were you able to walk that first
Yes.
day?
I walk
And do steps.
around.
She did unbelievably
And the steps.
That's one of the things that's fantastic.
well. But did you
about
notice the
that.
leg pain was gone right away?
The leg pain was
The
better.
numbness, the weakness.
You
Yes.
still had,
The
you
neck.
still were sore
neck.
from the incision, obviously.
The neck.
Yes.
I
The
mean,
neck,
you still had pain from
everything.
the surgery itself. You know, that
Yeah,
takes a
yeah,
while.
It's a different kind of a
surgery.
pain. The surgical pain is different than the.
Yeah, it's
Yeah,
different,
yeah.
yes.
Disc
That's
pain.
one of the things that the process any patient knows that it's something you have to handle on. Afterwards, you have to just, they give me a major, in my case, I'm open heart surgery, a major surgery. Of course, you have to, and when the moment that you try to straight up, you want to feel it, but it's like I just, it's a different kind of pain.
It's a healing pain.
Yeah, when I saw her stand up in the same day, when I saw her, because I was there 24/7 with her
Yeah,
in the
you were-
hospital.
you were an amazing
Yeah.
advocate. You were there
Right
all
there.
the time for
The
her.
So I
physical
saw her-
therapy team is very good there to help.
Yes.
Amazing.
They really
nothing can
work to
compare.
get you up right away.
Yeah.
Every
Yes,
visit
yes.
from your team too.
Every day. Mhm.
Not only the nurse station, every time that somebody show up like from you, amazing. And their treatment, the way that they talk, how
Yes.
they deal with the medication. It's like an exact plan for. That's amazed me. It's like every single medication that you plan, it's exactly what she needs. No more, no less.
Right.
And then if she needs some more for any reason, because of more pain or one day she wake up a little more pain, everything was discussed exactly how is. That is amazing for me. I never see something like that. I never saw something like that. So, I'm going to say so organized,
Yes.
so detailed.
Well, that's so great because
It's
you
a great
you hear
experience.
horror stories.
It's a great experience.
So that's very nice to nice,
And not give you medication for give medication. Of course, it's like, let's see how she improved with this plan. And then if something happens, we can change, for something else to see if she improved in that
Right.
with that medication. But that's what we discussed, like every single detail. Even the nurses get the details and the instructions follow so well because you prepare everything so well for your patients. I know it's not only for Marsha. I want to speak for myself, and I know she's agreed with me. That we discussed that in a home. It's like you as doctors, I know you do that every single time with your patients because it's not because a preference. It's not because it's a patient. It's nothing. Even if we can say you are special. Yeah, could be in a personal way. But I know you guys as a doctors, we are so grateful. I'm here to say thank you between our families. Say
It's our
thank you to
pleasure.
you. Thank you because every single detail, every single step, we know because they said Dr. Ovidian and the team, Dr. William and Ovidian and the team, want you stay with this medication until this. That is something that we appreciate, especially me, because I see very I go to the details. If you see me, I go to the details, especially with a family member. And it's something that we appreciate because they don't give you no more, no less until they see if everything is going to be okay. And the care inside for your team, the hospital for your team was amazing. Every morning they go to visit to her. Every afternoon, every messenger go straight up. We came to see how you doing. Myself, I never saw something like that. I told you, I have family. We are family. They go to the doctor. Family have experiences. Doctors are doctors. Good doctors, bad doctors. I'm gonna say, but everybody tried to do the best. But in this time, we are so grateful that everything come out exactly how they planned. And in surgery, the decision you took that I know, because I saw the images and we started studying the images. Myself, I studied the images. What is wrong? What is this? Because, some terms as a family member, you don't understand. You're not a doctor.
Sure.
But if you have the explanation and say, wow, how major is going to be the surgery, and the confidence that both of you has, to do the surgery, even if you may be concerned, because when you open up the patient, you don't know what's going to happen. I'm so grateful as a family member that you are the team
I'm
to
lucky.
touch
I'm
my
We're grateful to
sister.
have patients like you and family members like you that are involved, that are caring. We've been doing this for over 20 years together, and so we've got it down to a system
Yeah,
that we don't want to reinvent the wheel. So we rest
Yeah.
on people who came before us, and we learn
Exactly.
from them. And we've adjusted things so that we try to make it as smooth as possible,
We
so
make
that-
it
do
easy.
we do it the
Make
it
same
easy.
way every
System, yeah.
time.
and do it
make
consistently.
it so easy.
Yeah, when I was in training at the Hospital for Special Surgery, we operated on a lot of very famous athletes and movie stars and very, very wealthy people, very notable people. And I remember asking my mentor, Dr. O'Leary, I said, "Well, do you get nervous when you operate on such people?" He said, "No." I said, "Why? Why don't you get nervous?" He said, "Because I do the same exact thing every single time.
Like a recipe.
Whether it's the Prince of Greece or it's somebody off the street, and
Exactly.
it doesn't matter.
That's the way you have to be.
You have to treat everybody.
Otherwise, you'll
treat everybody the
otherwise
same
you
way.
really will be to the disadvantage of the celebrity that you operate on because
And you get
you'll be
nervous,
doing
'cause-
things differently. You know,
Because everybody that you operate on is a VIP.
exactly.
Everybody has a family. Everybody
Exactly.
they have children. They have parents. They have sisters and brothers, and they are all rooting for them. That's the most important person in that family.
Yeah,
So you want to get that person. You said she's the spine of your family.
exactly.
And we want to. We are lucky to have you as a patient and as a family member. Because this is why we went into medicine.
Yeah.
To help people who are struggling. It's very gratifying when you have somebody who has, intractable pain. It's upending their life. They can't walk. They can't do the things they used to do.
Exactly.
And they have a problem which they've been told is, well, you're just going to have to live with
Yeah.
it. That's the way it's going to be the rest of your life.
It's
And
just
you-
just
and you can
old
fix
age.
that. You can fix that. There's nothing more satisfying from a physician's point of view than being able to give somebody their life back, essentially. So we're grateful to you, and we're so happy. So tell us more about the recovery. When you first walked, were you using a walker at first, and then they graduated
Yes,
you to no?
yes,
So
the
how long
first-
were you on the walker for before they switched you to a cane or to
In
nothing
the hospital, I use the walker all the time.
all the time? Yeah, because they're afraid
Did you use
that
it
you
when you
don't
come home?
lose your balance and you're on
Yes.
medications.
You had it when you came home as well for
When
steadiness.
My home, we don't get walker that day.
You didn't you didn't go home with a walker, or did you feel like you didn't need the walker
She-
at that time?
Oh, we don't use the walker when
I think you graduated from the walker before you even left the hospital because you were
Yes,
walking
yes.
several hundred feet the
Close.
first day. Which is
That works.
which is unheard of.
Well, I mean, that's exactly how you know the patient is almost ready to go home because
Yeah.
they can walk independently.
Yes.
Right. There's 3 rules to go home. One is you can walk on your own, do steps. 2 is you can go to the bathroom by yourself.
That's
Yeah.
very important.
And 3 is you can take oral pain medicine or be comfortable.
You can eat.
You can eat.
Yes.
So those are all the 3 criteria that I use to know when a patient's
you have
ready.
all
And
those-
she was
all
ready very quickly.
And we took the drains out. The drains came out.
2 drains.
There's always drains whenever you do these kind of surgeries, just to take care of any excess ooze, from the surgery bed.
You don't want to get a hematoma or a problem.
I remember during the surgery, also of note. I mean, there was 2 components, of that narrowing of that canal that was squeezing the nerves. It was the thickened ligament.
Yes.
We also took out a big, giant piece of herniated disc.
Yes.
That was one of the things that really, I think, helped open up the canal. Now, and sometimes people have a disc that bulges out, but you don't necessarily have to go to take that out because you do enough decompression by taking out the other parts of the back of the spine. But in your situation, you really needed to have that disc out as well because it was so big. So I think that really
It's a
helped.
real
It was
herniation.
a real herniation, and your spine was unstable. That's why we needed to put the screws and rods in. And that's actually believe it or not, I always say the easy part of the surgery. It's not easy to do, but because you have to, but you do it over a long period of time, you get better and better at it. But the most important thing is the decompression. That's the art of the surgery. So in any event, you felt better. Your leg pain was better.
Yes.
You went home, and when you went home, what was that like for you?
My home was normal, but no, with pain, a lot of pain, because
Pain in the back.
to go to lay down to my bed, like to walk not too hard for me. Just to lay down to the bed was the
Yeah, getting out of bed is a big problem
Yeah,
because of
big
the incisional pain from the back, but the preoperative leg pain was dramatically
That
better.
was the leg pain is often the most disabling component to the pain. Most people can almost manage their back pain to some degree, but the leg pain is really the thing that gets people.
Yeah, but I don't have no pain. You are for me a lifesaver because
Thank you so much. We
it's,
really
it's
appreciate
something.
that.
It's a miracle. To me, it's a miracle. I
the
think, and my neck, the pain that I have in my neck and my.
It's amazing how all
But now,
everything is
Everything's
interconnected.
Everything's connected.
yeah, it's something. And another thing, before the surgery, I had this side like this before, and now
You were
Corrected.
tilting to a side
I
to take the pressure off the nerve, is what you were doing.
you fix that.
I,
too.
I, I
Because
remember. I
everything
remember
is
that
I
he
don't
said
pay
one
nothing
thing.
for.
That's
Yeah.
great.
I remember that he says one thing. When I see the images, because she has that kind of problem a long time ago, like she has a little bit.
Little scoliosis.
Yeah. And he says, and we fixed that in the surgery. That's the decision that we make more special. That when the doctor do the right thing inside to the OR, it's like, oh, I see something right here. What I have to reopen the person the same, and then you're gonna say, oh no, now we have to do this because we saw this and we have to reopen it again. But you're gonna heal in this one, but we're gonna open it again, and then we're gonna fix that. No, you take the right decision right there because it's not useless. You know how painful it is to pass through that process, and we appreciate that too.
Thank you. And that goes to the trust of the surgeon also.
And
You know,
that's what it is.
sometimes things happen in the operating room
Yeah.
that are unforeseen or that you don't suspect and or you don't expect. And the patient has to have the trust in the doctor
Yeah.
to do the right thing at that moment. For example, just like recently we had a patient who we opened the wound and there was a fatty tumor, a lipoma. So we removed it at the same time.
That's
And the
right
patient
decision
was
right there.
thrilled that we got it out. It wasn't something that we had discussed before, but it was there.
Yeah, because
We had no choice but to remove
I
it because it was
told-
right in
Yeah,
our
yeah.
field.
It was right in the field, so it had to be removed.
in the field, in the middle of the way.
When you had how long ago did you have the surgery at this point? How long has it been? When was the date?
2 months now.
Was that end of October?
3, not 3.
3 months.
3 months. You're 3 months post-op at this point.
Yeah.
3.
So overall, at this point, how do you feel? You feel pretty good? You feel like you
Yes, I
can
feel-
do more things than you were able to do?
Yes, little by little, I think I'm gonna be
Back to normal.
play games.
Do you still take any medicine for pain at all at this point?
Not now.
No
No medicine.
No
Nothing.
medicina.
Yes, no medicina.
That's wonderful.
Because that is good. Because he said to me, the Dr. Obirian, he said that you take it if you need it. But
Everybody's different. Yeah.
but sometimes
It's normal sometimes to get some
Normal to
occasional
take it, yeah.
bouts of back pain and things like that just from normal activities.
Yeah,
I get back pain once in a while, and I will take a Motrin or a Advil,
It's
normal.
thing. It's a
Normal.
but not that constant pain or that nerve
Exactly.
pain, that
Yeah,
debilitating pain. That's not something that's normal.
Yeah.
You know, and that should not happen at any age, really.
Sometimes
Yeah,
pain
yeah.
can recur temporarily. You can feel the same distribution
Yeah.
you had before, but it should go away. It should not be.
Yeah, sometimes
Yes.
people have herniated disc. They have a sensitive nerve in that area because it's been compressed for a long period of time,
And it can
get irritated again.
automatically discharge,
Yeah.
abnormally, but that's just basically because the nerve is still healing. It's still not perfect,
Yes.
at that point.
Yeah. That's
but
what
the
we said.
physical therapy helped me a lot now.
Are you getting any physical therapy now?
Yes, I have it
So you're getting some
right now.
outpatient physical therapy.
outpatient physical
Yes.
therapy, yes.
And that helped me. I had good lady that she's very good.
That's good.
She
Did,
really
did
has a
the
lot of
numbness get
pressure.
better in your foot?
Yes.
So that's
I
good.
don't
Sometimes we tell patients it can take up to a year, and sometimes the numbness doesn't resolve
That's what I think.
100%.
This is something that is pointed out as a major surgery that you says is a major surgery, and the recovery is amazing because in 3 months, in the hospital, first day she walks. I was there. First day she walks in the steps. Second day she was doing her necessities without no problem. Third day, she was eating very well and do all the necessities plus the walking. Amazing.
She's our A student.
Yeah.
So basically,
Yeah.
in summary,
Yeah.
you had spine surgery. Spine surgery is indicated on patients, and that's one of the most important things is choosing the right patient. And I think that people are very frightened by spine surgery. There's a mystery to it. People, when they're told, okay, you need your gallbladder out, okay, but when it comes to the spine and nerves, people are very, very scared. So here's a patient who underwent spine surgery by us and lived to tell the tale, and he's here talking about it. And I think that because we chose, wisely, and you chose us, I think that it really worked out the way it should work out when you have a real problem, and it was a real problem that you had, and your symptoms have a very high chance of going away. Not all the time is there a guarantee of that.
It is.
So we have some luck and God helping us. There's a lot of that driving force behind all this too. Not every time does everything, but that's important. And of course, we would never bring a patient on who was miserable having the surgery. But with so much thank you.
But her imaging studies matched what her symptoms were,
and that's the most important thing.
She wasn't taking
choosing a patient.
Much narcotics beforehand. I find that patients who are taking a lot of painkillers before,
it's much harder to get them under control.
Because they have to up their pain medication initially after the surgery because they're in so much pain from the incision that it's harder to get them off of the painkillers. It can take a longer period of time. But our goal is to have a patient be off all their medications and get back to their normal life.
That's the
the numbness can sometimes take up to a year to get better. Sometimes it doesn't get better 100%. But as long as the pain goes away and you're able to return to functioning, and her strength got better as well, which is also excellent. She had a really good outcome.
Absolutely. We're very pleased. And we're, hopefully just continue and improve.
Do we have the
throughout
films
the
to
rest
show?
of they're going to be part of the podcast editing, actually. To come. That's to follow.
Okay.
Okay.
I'm going to point out something that I spoke with Marcia a couple of days ago. One of the things that amazed me is when we go to the follow-up appointments, my observation, right, is I don't see one patient sitting down in that waiting room that you consulting, they use a wheelchair. And it's a plus. That make you, me, myself, when I see that, I say, you see, nobody have wheelchair over here. What that means for a
patient's
for the
perspective.
patient is like everybody's walking.
You always wonder why are they in a wheelchair, but sometimes sometimes they come in a wheelchair before they have the operation.
That's what I'm saying. That's what I'm
choice.
saying. That's what I'm saying. It's
Yes.
like you don't see in a only success surgeries when you see the room that you go after post surgery and the follow up and when you consulting in your clinic and you see 20 patients and not one of them use a wheelchair.
Yeah.
Well, that's very. It was a lucky day.
That's a record. No, and we went.
No, it's most days.
No, it's not only one. We went to your clinic. You see the patient after surgery. Same thing all over again. You don't see no patients, and I'm in front of the camera. We don't see no patients with a wheelchair. That is amazing.
Yeah.
That says a lot of things without no words.
What's interesting is that a lot of patients who are thinking about doing the surgery will sit in the waiting room, and they will, they're a little nervous. They haven't met me yet, and they'll talk to some of the other patients sitting in the waiting room, who will tell them, "Don't worry, you're in good hands." And our biggest referrers are actually
Other patients.
The patients.
who've had the operation. We just operated on somebody last week who came because we had done an operation on his next door neighbor. And so they were referred to another surgeon, but they said, no, my neighbor said to come and see you, and he was glad that he did. So we appreciate that, and we don't take it for granted at all how nervous people are before, because it is a big deal to have any kind of an operation.
People actually think that they're going to be in a wheelchair after spine surgery, and that's just simply not true. That is not the way things go.
That's
what I
normal.
That's what I pointed out that because I saw in your clinics that you don't see no patients. You can see with a cane, try to or with a.
It's not to say
the
we've
one-
never had
it's
a
not-
patient not
It's not
feel
like in
the way we
wheelchair.
want it- as well we wanted
and
it
that's
to
the
be.
scary part. I want to tell to everybody the scary part. Like it's something that you says, oh, if I have a back surgery, I'm going to be in wheelchair the rest of my life.
That's just not the
It's not
norm.
the truth.
That's not the truth.
It's not
yeah.
the truth because we are here to say that it's not the truth. And another thing is that me as a family member, and we discuss that every time that we get there, say, well, nobody is in the wheelchair.
But sometimes
You know, as a spine surgeon, you never want to make a promise to a patient that you're going to. So knock on wood.
Yeah.
We've had
Yeah,
good luck as far as that goes, but that the good luck comes from being trained well,
Yeah.
from having good judgment,
Yeah.
picking
choosing
the right patient,
Choosing the right
Yes.
patient.
and,
is very
and doing
important.
the right
That's
operation for
another
that
thing.
patient,
Yeah.
so that they do have a good outcome. You know, because you had a lot of back pain and leg pain. Some doctors may have just done a discectomy, and then you would have,
Going home.
You could have had a recurrence of that
get a
disc
recurrent
herniation.
disc, and then get developing protracted back pain, and then
Yeah.
the other leg starts hurting more. You know, a lot of So when we do an operation, we take all of those things into consideration
Yeah.
as to what is the right operation. Because somebody maybe they're 25 years old and have a herniated disc, they would get a discectomy alone without a fusion.
Exactly.
Or sometimes they don't need the hardware, or there's so many different options. And so that's where the clinical judgment of the surgeons comes into play.
I think that if in your situation, I think that there would have been if we had just taken out the disc, I think there would have been a high chance that your disc could have reoccurred in the future. And I
Because of the
think
instability, and also because of the nature of the operation we did with the iatrogenic instability and the discectomy and the wide decompression, that we wanted to make sure you were stable completely before.
Yeah.
And at 61 years old, it's totally appropriate.
and you have a long life ahead of you to
yes,
go through.
yes.
So
Yeah.
we
Right
wanted to
now,
make sure you try to do it right the first time.
the
kind
way
of.
that I
you're,
feel.
you're middle aged. We want you to live to 120.
Yes.
I-
She says all the
I'm
time,
looking-
actually.
yes.
And you might do so
Like
with,
Moses.
with AI
Yeah.
now.
That's what she says all the time.
That's the future.
Yeah. You're the
We
future.
really
That's you.
appreciate you coming to see us today
Thank
and
you.
talk
Thank you
about
for
your
inviting us.
experience.
Thank you.
It's just wonderful to see
Is there
you
any
guys.
advice you would give to a patient now regarding your whole experience? Like, what advice would you give to a
family
patient who hasn't had this operation but is nervous about it, or is suffering, but is afraid? What would you tell them?
Okay. And like I
Can I say
said,
something?
go ahead.
before?
Go ahead. Yeah.
Yesterday, a friend of mine, she called me and she said that she knows somebody that have that problem. And I say, well, I have somebody. I have the doctor.
There you go.
That is the best.
A
the way
recommendation.
we get
That is the best.
referral.
Yes, that is the best. The way that I feel, the way that my recovery, everything is amazing. It's unbelievable. That's why I recommend you
We
to
appreciate that.
anyone.
Thank you.
Because my experience is because I was very skeptic with
Skeptical.
when it's about my health. I'm not doing right away. Like I'm not decide to do things right away. But
Sure.
with you, I don't know. I'm not.
Thinking so much. Yeah.
We connected right away.
Yeah.
Yes,
You had a good
it
connection.
was it's a miracle. A miracle for me. It's a miracle
Yes.
because I think in my home, I sitting down and I think in you and both of you and I say, but how I can't believe it. It's
Like it
something
live.
that I can express myself.
It was meant to be. God works in mysterious ways.
Yeah, yeah, he does.
And I
Right.
do, and my son, he said to me, "Oh, you walk too fast. You had to." I said, "No, because I had to do it because if I feel good,
You're going to walk fast.
Yeah.
What I tell patients is they always ask, "What can I do after the surgery?" I said, "Well, if it hurts, don't do it. But you can basically do whatever."
I was
doesn't
common
hurt."
sense.
I'm
Yes.
worried when I
not
walk
so
into
common.
her, and I was wait.
Oh,
But you
she
go
said
too
to
fast.
me, "Oh,
wait,
get the
wait,
cane."
because
I said, "No, no,
it's
no.
fast. So it's amazing.
Let me walk like that
Like
without
that, yeah.
cane because I want to be normal again.
Sure.
Like a
That's why we did the
life.
operation.
Yes, yes, and I feel I had to do it, and I appreciate. You don't know how.
Oh, we
I appreciate.
certainly
it. And
we
thank
feel
you,
it.
thank you,
Yes.
thank you very much
Oh, absolutely.
for help me
Our pleasure.
to go back to my normal life because I wasn't very different. Oof! Now I'm alive.
Now you're back.
I'm alive. And
back.
Yes. Thank you.
That's good.
Yes.
You were going to say something?
Yeah, I would like to say that not every case is the same, first of all. And I recommend to everybody first to consult them. You know, you are the team, William and Dr. Ovidian. That is possible to get healed in something so difficult. And the decision as a family member is something that you can discuss with the team, the Dr. Ovidian and William. It's possible to see the recovery. It's possible to see a hope after the tunnel and such a pain. And it's not be afraid. Not everybody's the same. Now everybody has the same results, yes. Because life is like that. It changes to one, to another person is completely different. Hashem knows, God knows. But I recommend to everybody to do the consulting. If you have that kind of pain or your family member has it, please contact them. They are a good person, they're good people, good team, and they are involved with your family. It's not, you're not alone. In the beginning of the process, you're not alone. They discuss every single thing with you and with your family. And you feel that you're really, really part of the team. When I remember one thing when they went to the OR, the Dr. Ovidian approached me and says, "You are ready?" And I said, "You are ready." He says, "Yes, I'm ready." So I'm ready. And then when he come out, every time that he come out, he says, "Flawless. Everything is fine." That is the team that you need. And I encourage every single family member to be part of the whole process. That's what I said. The doctors are doctors and they have more experience. Of course, we are in their hands, but I believe that they have to be involved. And I recommend it 100% to come to see you guys. You are amazing. The team is amazing.
Thank
and
you.
as a family member, I told you how calm you are in the living room when you have a good team and you know
thank
the
you very
person
much.
is in charge.
Thank you.
Both of you are in charge, and then it's something that you feel like, oh yeah, everything is gonna be okay.
Well, thank you very much for
Thank you
for
so
saying
much
those
for
kind
everything.
words. We're so pleased about how you did and everything else.
A consultant is a consultant. You can see a lot of doctors.
It's true.
You can see how many doctors you see, like 3, 2, 4, 5. But the one of them makes the difference. And I feel this is the difference for us in a major surgery. As a family member, again, thank you.
Very
And I
welcome.
have to say thank you
Thank
to
you.
Lauren too.
Oh, Lawrence, all the team.
Lauren,
Lauren,
Lauren
all the
is
very
team.
nice.
Yes.
Lauren is the heart and soul of our
yes,
practice.
Yes, it's
Very nice.
all the team, yes, definitely.
Yeah.
Thank
Secretaries,
you so much for
everything.
Thank you.
coming down here and talking about your experience, and we appreciate it.
We really do.
And
Thank you.
Thank you so much. No,
we will
thank you.
continue to
Both of you.
look forward to seeing you only get better.
Yes.
And we will continue
And
to
I
pray
think I will be
that will
set.
happen.
Yes, thank you.
Hopefully you don't need the spine surgery.
I hope not that big, but I think I'm gonna be. I do my own recommendations, so
But we're available if you should ever need us.
yeah, I hope not, but I think yes, that's what I'm saying. It's like something that I'm gonna say in
Want you to always
public
be
right now.
healthy.
It's like I'm gonna be next and I'm gonna be okay. When I said when she's having the recovery, I'll be the next one because I have such problems in my spine.
No, you're gonna-
So and then I'm 100% confident that everything is gonna be okay in your hands.
Thank you.
Well, this was our conclusion of our 5th podcast, and with our special guests, Marcia and Hannah.
Yeah.
Thank you so much
you.
for coming here.
Yes, thank you.
Thank
you
you
so much.
Thank you.
And
you.
and
Really
we look forward to your continued recovery.
Thank you.
Thank you very much.
All right.
Thanks.
Thank you so much.
Thank you for coming.
Okay. Thank you.